Hi everyone, I'm Bronwyn Fitz, an integrative gynecologist and functional medicine doctor, and today I'm going to talk about intermittent fasting. It's all the rage. I mean, it seems like you can't get on the internet without hearing about it, and it is pretty exciting. There's a lot to it, so that's what all the hype is about. People are looking at intermittent fasting for a couple of things. The first thing is weight loss. People get very excited about weight loss opportunities. And I'm excited about that, but I'm more excited about the potential for longevity. You know, as human beings, as we evolve, we're living longer and longer, and there's a lot of problems with chronic illness, right? This is the whole thing about functional medicine, and why am I a functional medicine doctor? I want to help people with chronic illness. So we want to live longer, but we want to be healthy during those longer years, and so the field of longevity research I just find fascinating because really, as we live longer, we want to live healthier also. And so I think intermittent fasting has promise in this arena. But just to go quickly into fasting, fasting itself can refer to eating nothing at all. Sometimes people describe water fasts. Some people will talk about juice fasts. You can also do just a fast with sort of a low calorie diet as opposed to your regular kind of food intake. So there's many iterations for intermittent fasting. And there's a growing body of research to really support all of these different kind of ways of approaching eating. There's three main techniques that I'm going to go over that I think are the most accessible, the most popular. The first one is called timed restricted eating. This is when you shorten the window of the hours of the day where you eat. So if you can prolong the overnight fast for 12 hours, 14 hours, even 16 hours, you get real metabolic benefits. So this is a really easy entry point for someone who's interested in getting into this, and there's data to support it. So the way it works is if you stop eating at 7 p.m., a 12-hour fast is not eating until 7 a.m. That's pretty doable for most people, and so I would say then stretch it to don't eat until 9 a.m. That's a 14-hour fast, or to 11 a.m. And then when you do eat between the hours of 11 and 7 or 9 and 7, essentially you eat your normal healthy diet. There's no restrictions, and the only restriction in the morning is you can have a non-caloric beverage. So tea or coffee is fine. We just really try to limit the number of calories your body's getting. And the next most popular way that people do fasting, incorporate into their lifestyle, it's called the 2-5 plan, where 2 days a week you have a very low calorie day, and then 5 days a week you're eating normally. So on those two days you're eating maybe 500 calories, and they should be very healthy calories. And you can work with a nutritionist or a doctor to figure out like what those calories should look like, but generally I tell people mostly plants and some oil, some healthy olive oil. And you want those 2 days ideally not to be consecutive. And there's data to show weight loss with this plan. And then the last technique is called the fasting mimicking diet, where you have 5 days of very low calorie intake a month. So 5 consecutive days of low calorie, and then you're eating your regular food the rest of the month. And you can do that several cycles in a row. I'm going to devote a whole other blog to the fasting mimicking diet because it's very sophisticated, and there's a particular product called Prolon that you can that utilizes that technique, and I recommend that one. But the benefits of the intermittent fasting are weight loss and improved biomarkers. We're seeing improved cholesterol, we're seeing improved inflammatory markers, improvement in blood pressure. All kinds of markers of health can be improved with this intermittent fasting. It doesn't matter which one you do. We don't know which one is best so far of the three I just described. I think time will tell. My personal opinion is that the one that you're most likely to be able to do is probably the best one for you. I think the restricted eating, where you just extend your overnight fast, that's so accessible to most people. I think you can just go ahead and try that on your own. The ones where you're getting into real calorie restriction, like that 2-5 plan or the fasting mimicking diet, I would do that with the help of a nutritionist or a healthcare practitioner. But all in all, I'm very excited about intermittent fasting. There's a lot to it. If you're interested in learning more, check out my website, Women's Integrative Health. Give the office a call at 203-900-4194. I'd love to set up a free 15-minute consult and talk to you about it. All for now. Take care.